Hi everyone, this is Janet Hill at the Rock Island County Health Department. Thank you for joining us. It is a little bit after 3 on September 24th, a full 6 months into the pandemic. Today we are going to be talking about children and COVID-19. Anyone who has been around children knows that they generally can be kind of snotty and sick for the entire winter months, so we're going to try to have a couple of physicians help us suss out exactly when to seek medical attention in this more challenging time. But first of all, we're going to start with our health numbers. Nita with Rock Island County, can you start us off, please?
Sure. Good afternoon. Today, Rock Island County Health Department is reporting 26 new cases of COVID-19, which brings our total to 2,971 for Rock Island County. 18 people are currently hospitalized with COVID-19, and our death remains at 82. Thank you.
Go ahead, Ed.
In Scott County, the number of cases stands at 2,912, and our deaths remain at 28. A topic at the forefront of our minds is the return of in-person instruction for the schools in our county. We have shared on numerous occasions that schools are affected by the level of spread of COVID-19 in their communities and have had cases in students and staff. This was expected, and we've been working diligently with our school districts to support them in their plans for reducing risks as much as possible in their school buildings. Parents play a large role, not only in protecting children during the pandemic, but also helping protect their child's school by ensuring that their child does not take the virus with them when they enter the school. This can be a challenge as the experience that children have been exposed to and infected with the virus appears to be different from what adults are experiencing. Add to that, there are a variety of childhood illnesses with symptoms that can be similar to symptoms of COVID-19. We've asked pediatricians from our community to join us on the call today to help inform parents on how best to protect their child from COVID-19, how to identify symptoms, and how to handle testing in quarantine or isolation should their child become ill or be a contact to someone who is positive.
Thank you, Ed and Nita. So with us today, we have Dr. Anita Ahuja of UnityPoint Clinic Pediatrics in Bettendorf and Dr. Deepna Kukreja of Genesis Health Group Bettendorf Pediatrics. So the format today will be, I have a few questions to go through, but as always, any media that has questions for any of our panelists, you can put it into the chat box. And then we're going to cover kind of a broad range of issues that parents may be thinking about with their children during the time of COVID. So let's start with Dr. Ahuja. What types of symptoms are children experiencing related to COVID-19?
So the symptoms that children experience compared to adults can be very similar, most commonly fever and cough, but they may be asymptomatic as well. It's also a confusing time of year because there are other illnesses like other respiratory viruses, including flu coming up, as well as allergies this time of year. COVID, as we know, is still spreading through the community. So having fears about their children or their family contracting COVID is valid.
Okay. Can you kind of differentiate some of the symptoms between COVID and other childhood illnesses that you alluded to?
Sure. So some of them can be quite similar. What we see in general is that flu symptoms do tend to come on more quickly, with COVID symptoms appearing a little bit more gradually. Some of the differentiating things between the two, you're more likely to see loss of taste or smell with COVID. And children are more likely to become very ill with flu than they are with COVID. Although COVID has this associated multi-system inflammatory syndrome that has been associated with it, where children can become very ill afterwards as well. So it is important to make sure that your children are following the necessary precautions So wearing a mask when you are out in public and social distancing as best you can. Paying attention to your child and their behavior and their symptoms, because the parent may notice those things before the child does. And it's extremely important this year for everyone, both children and parents alike, to get their flu shot, because there can be co-infection between influenza and COVID, and we don't want to have to be dealing with both.
Thank you. So when should a parent keep their child home from school or childcare?
Sure. So luckily we haven't seen a ton of cases of children with COVID in the area yet, but that's obviously something that we're concerned about. Like with any other respiratory illness, if your child has fever or cough, that could potentially be a sign of COVID or of influenza, and we don't want them to spread either one to either their other students or the staff at their school. So in those cases, they should be staying home as well.
Thank you. And when should a parent contact their medical provider for possible testing for COVID-19 for their child?
So they should never be afraid to reach out. So if at any point they have questions, they're not sure what to do, they should always reach out to their primary care provider or pediatrician. There's also information on the UnityPoint website at unitypoint.org about COVID, and then specifically in children, as well as information on flu shots. And then important things, if they are concerned that their child has symptoms, they should definitely reach out, or if they've had exposure, please feel free to reach out to us with any questions related to that.
All right, thank you so much, doctor. Let's go to Dr. Kukreja. If my child tests positive for COVID-19, how long does he have to stay at home?
Okay, yeah. So if your child is positive with COVID-19, our recommendations would be to have him quarantine for the full 10 days from the date the testing was done. And he also has to be completely symptom-free without any fever reducers or any medications.
Okay, so should my child get tested for COVID if he has been around another child or adult who has tested positive?
So our recommendations are that there is no need to get tested. If you have already been exposed, we are going to have you do a full 14-day quarantine. And this is inconsistent with the health department recommendations as well. And we agree with that. So we have been waiving our parents not to go for testing, or if they really want to, then it's better to wait for the full 5 to 7 day period, as the positive predictive value of that test is going to be higher if they wait a little longer. Otherwise, there is no need for testing. The results of the test are not going to change the quarantine period. So really there is no sense for it. Anytime during this 14-day period, if they develop any symptoms, it is strongly recommended to get tested.
Okay. When is the viral load for, when is the best time to get tested? When is the viral load the highest?
So 5 to 7 days after exposure is what typically has been seen that the predictive value of this test is going to be higher. So you could have a negative COVID on day 2 of after exposure, but that doesn't tell you if you're still asymptomatic and you've been actually carrying the virus. So it's better to wait till the full 5 to 7 days are over.
Okay, thank you. How can I protect my child from getting COVID-19 in the first place?
Yeah, this has come down to basics. Our best line of defense is ourselves, making sure that we are keeping our social distance going, even with back to school and the daycares opening up and the life almost coming back to normal. We have to understand and we have to reinforce to keep our masks on, keep our social distance going, avoid community gatherings. Good hand hygiene should be maintained. And again, as Ed said, it is the parent's responsibility that if you have a kid who is showing any signs or symptoms that could be COVID, do not send him to school. That's our biggest ask, our biggest request to the community, because that is how we are going to flatten the curve. We don't want to overwhelm our health systems. We want to give time. We also want to learn more about this virus as we go forward. At this time, our understanding and our knowledge of this virus is very limited. We are seeing a lot of pediatric patients coming back positive, which was expected with the school going back on and the life going back to normal. almost normal, but we don't want to overwhelm our health system at the same time. Fortunately enough, the kids have not been very sick. All we have seen is very mild sickness, and most of them have recovered at home. We have never received another call from the parent on any other questions because the kid did just fine. Most of our patients actually have been sick for no longer than 24 to 48 hours, which is really nice to see. Many of them have actually been completely asymptomatic, but they have been tested because of close contacts at home. So having a close contact, a parent or a family member at home with you is by far the biggest risk factor to, get alerted, get tested, and that's where we are actually seeing the pediatric patients come back positive.
So you're talking about how children don't get as sick. What role do they have in spreading the illness to others in the community?
Yeah, pediatric population is very vulnerable. Also, at the same time, it can act as a big vector because kids cannot handle, their oral and their nasal secretions as well as adults can. Keeping a mask on is also a struggle sometimes with kids, especially with behavior concerns or kids who are younger than 4 years of age. So they definitely play a very big role, I feel, in spreading it in the school systems and out in the community. And that is where, parental involvement and parents' guidance is very necessary. And I've been very much in touch with the school systems on their recommendations and what are they wanting the parents and the patients to do. And I think everybody is being very cautious, overabundance of caution here in this case, and trying to, do everything in their control to limit the spread in the community.
Okay, and this is to either physician. What is the process for testing for children within each health system? Who would like to go first?
I can take that. So most of our patients, when they call our office, we give them two options. If the parent wants the kid to be seen for any reason, they are more than welcome to come and see a provider in the clinic. We do have special precautions in place to make it easier for the parent as well as to prevent the spread inside the office. So we have them come in the clinic through the back door. We have a dedicated staff member and a dedicated provider that works with them the whole day in their full PPE. The PPE is donned and doffed on with every change of patient, and the rooms are aggressively sanitized after we see them. We also have dedicated exam rooms for sick patients. So if the parents would like the child to be seen, especially the younger kids, I would urge them to likely have them get seen by their provider as much as possible. For older teenagers and adolescent patients, it is fair enough to have them go through the drive-through collection site. So Genesis has 2 drive-through collection sites in the area. One is in the Moline Healthplex, and the other one is at the intersection of Northwest Boulevard and 53rd Street. So we have been urging most of our older patients, if they've been stable and the parents are confident that they are not missing on anything at home, those patients are going through the drive-through and getting the COVID test.
Okay, thank you. Dr. Ahuja, do you have anything to add to that?
With UnityPoint, it's a similar situation where if a parent wants their child to be evaluated, we certainly want to evaluate them as well. We have certain locations that are doing the testing. At this moment in time, not all of the clinics have all of the testing supplies to do the testing. So if a parent has concerns about their child, call into that specific office and they will be able to tell you whether or not that's something that they're performing in their office, or if they're not, where is the closest location where they are doing that at the moment. And they can actually on the phone assist you in scheduling that appointment. And then similar to Genesis, so when the parent arrives at that location, all of our locations are having the parent text when they arrive, and then when a room is clean and ready for the family to come in, the patient and their family will be called in and then brought immediately back to an exam room. And then a nurse and a provider will be the ones to see them, examine them, and perform the testing as necessary.
Okay. What else would you like parents and families to know about COVID in children, or perhaps COVID just generally in a family setting?
My biggest advice for the families as we entered into the flu season is to please get their flu shots. We know much more about influenza and we have a lot of options. We know we have preventative modalities, we have treatments, outpatient oral medications that can be given. We know a lot about influenza than we know about COVID. It is natural to have that fear. It's the nature of the beast. We just don't know enough and it's a novel virus. But I don't want parents to forget the importance of influenza vaccine this year, which has never been more than before. As Dr. Ahuja pointed out previously, that we do not want a co-infection complicating the whole picture. Kids are very prone to get influenza every year, and still the mortality rate and the hospitalization rates from influenza far exceeds from COVID. The spectrum of COVID is ranging from very mild to very severe. We are not seeing the severe part of the spectrum. The MISC, which is another new clinical entity that came up with COVID, is more a post-infectious inflammatory response. Most of the time in the literature, it's been written that it's seen when the wave of COVID passes the community. So I'm keeping my fingers crossed that that's not the case with us and we won't see MISC coming after this wave of COVID passes. But as far as now, we are a group of 9 pediatricians in Genesis, and we have not seen any patient with any severe symptoms of COVID needing any hospitalization or transfer to the higher care centers. And we have also not seen any case of MISC.
That's good to know. Dr. Ahuja, have you seen the same thing or anything different as far as the multi-inflammatory or any serious cases of COVID in your practice or your health system?
Yes, we also have not seen any of those cases of MISC here, just like Dr. Kukreja mentioned. Hopefully that is something that we don't see as the initial wave of COVID passes. And we also have had almost all of our children that have become ill have been either were asymptomatic or very minorly ill, like a minor respiratory infection.
Could you remind us again the symptoms that parents should watch for?
As far as COVID?
Yes.
Okay, so looking out for fever or cough, those are the most common symptoms. They can range anywhere also from runny nose, sore throat. Sometimes it can have GI symptoms such as diarrhea as well. So if there's any concern anywhere along that spectrum, we would much rather speak to a parent and figure out a course together.
Okay. Well, that is the end of my questions. Does any media have any questions that they'd like to put into the chat? Well, I am seeing none. Well, I want to thank both of our physicians for taking the time out of their busy days, and all of you for joining us in important information, trying to understand exactly how COVID is impacting our youngest members and how it can spread to other members of our community. We expect to be talking with you on Tuesday. I will send out an abbreviated media release because neither of the physicians spoke from prepared comments today. So thank you all, and I hope you have a nice weekend. Bye-bye.
Thank you. Bye.